Welcome back to the Physio For You podcast, where pain meets its match and recovery becomes your new normal. I'm your host, Giri Srinivasan, registered physiotherapist and your personal movement strategist. Today's episode is all about jaws. No, not the shark movie, your actual jaw. Because if it clicks, locks, or aches, whenever you yawn or eat, this episode is made for you. Temporomandibular disorders, or TMD, affects the joints and muscles around your jaw. It is the reason your face hurts after yawn, or why chewing gum feels like a gym workout. From the car crashes to clenching through stress, from sports hits to the posture problems, temporomandibular disorder shows up in more ways than you would expect. So I would like to call it the shoulder pain of your face. Everyone ignores it until they can't. So, how do we actually figure out what's going on? Let's start with the subjective exam. That's your story. We usually ask, when did the pain start? Does it come and go or stay with you like an uninvited guest? What triggers it? Yawning, chewing, speaking, and one biggie, are you grinding or clenching? Spoiler alert, if your jaw's sore after Zoom meetings, you probably are doing that. That's stress. Your jaw's been taking the hit very quietly. Now, let's talk about observation. We first observe the posture first. We assess your head, neck, and jaw alignment. Because guess what? Your jaw does not float in space. It's attached to your head. So the forward head posture we are doing with our laptop work, computer work, and also the cell phones. Hours staring at your phone, that changes your jaw mechanics more than you would think. We then test your jaw opening. Ideally, it has to be between 30 to 50 millimeters. That's about 3 fingers stacked vertically, like that. If your jaw whirs off to the side, clicks, or opens like it's auditioning for a TikTok challenge, we take a note of that. We are not just looking for a range, but how smooth and controlled that movement of your jaw is. Then we go on to palpation and the intraoral check inside the mouth. We assess the muscles around your jaw. First externally, look for tightness and tenderness. Then yes, we do go inside your mouth. Apparently, obviously we wear gloves, but we check bearing patterns on your teeth. Feel those deep pterygoid muscles inside and also the small muscles around the jaw. They kind of tell us everything about your clenching, stress, and loading habits. Then let's talk about joint mechanics, your TMJ mechanics. That is your temporomandibular joint. That's a kind of a hinge/glider that makes all your jaw magic happen. From talking to chewing to yawning to ailing, everything. So what do? We check for movement restrictions. We check for clicking, popping, or locking. Ever had your jaw kind of lock in mid-yawn? Yeah, that's not normal. We want to fix that. We use techniques like distraction and glide test to assess the disc mechanics and also the joint health. That's very, very important. And then we will check the muscle function and also we do a bite testing. Now, muscle function. We watch how you bite. How do your muscles coordinate? Is the force equal on both sides? And a lot of you are chewing like pirates, only on one side. And that asymmetry leads to dysfunction. We retrain your jaw to balance, relax, and recover. Because overuse is a very bad habit. You don't even know you are doing it. Here's the truth. Jaw pain does not just fix itself. And waiting for it to go away, usually it makes it worse. Whether it's from a car accident or a sports injury or years of silent clenching, temporomandibular disorders needs expert attention. So, if your jaw's been clicking, hurting when you chew or yawn, or causing neck pain or headaches, do not wait. Book your physiotherapy session in your neighborhood physio clinic, or you can call one of our clinics to book your appointment. At Physio For You, we assess the full picture and will help you to get back to pain-free talking, eating, laughing, and living. Because pain-free is not a dream, it's a plan. And it starts today. This is Physio For You podcast, where science meets movement and your body gets a rehab it deserves. I am Giri Srinivasan. See you in the next episode. Bye.